Hello everyone, and welcome to another Arthritis Help session where you learn to move differently so you can feel better. I'm Dr. David Sofer, physical therapist, and today we're going to be talking about balance. Balance is so important for daily function, obviously for safety first and foremost, but also for just getting through our daily lives, feeling comfortable on our feet, feeling comfortable outdoors and walking through the community and socializing with friends. So first I want to talk about the safety aspect. 1 in 4 adults over the age of 65 will suffer fall in a year statistically, and that number unfortunately keeps rising. And of that number, about 5 to 8% a year have significant injuries. 3 million people a year wind up in the emergency room because of injuries sustained from falls. So today we're going to talk about assessment and how to understand pretty much how good you are at balancing. And then we're going to get into a little bit of treatment. And then next week we're going to do a whole nother video with focusing just on how to get better. But today we're going to get a self-assessment because, believe it or not, people are actually not really great at being self-aware of how good their balance is. Plenty of times I have people come into my office and they say they feel comfortable and balanced on their feet, and I do a couple of tests, and lo and behold, they have poor balance. They can't manage on one foot or narrow base of support. And then there are other people that come in and tell me my balance is terrible, and then I test them and they're really pretty solid on their feet, but their perception of themselves is off balance. So today we're going to do some objective measures to see how well we balance. Now, balance is an extremely complex body system. It incorporates inputs from so many different parts of the body and processing all together to give us that feeling of balance and security. And because it is such a multifactorial system, there is no one test that will adequately screen your balance, because you can have deficits in one area but be solid in another, or overlap, or multiple systems. So there's not one exercise that improves balance. There's not one test that can tell you whether you're good at balance or not. And so today we're gonna look at a few really key elements and see how well we do. But before we do that, I just want to explain how the balance system works. We have 3 main sensory inputs that we use to maintain balance. The first one is our vision. So we look around the world around us and we orient ourselves based on how the world looks on the horizon line. When that vision is removed, we tend to be a little bit more unsteady. So if our eyes are closed, or if there's low lighting, or if you're vision impaired, your balance is going to be a little bit less secure than it would be otherwise. And that's why very commonly, sometimes people wake up in the middle of the night to go to the bathroom and the lights are low, and that's when falls can happen. So we're going to look at balance, visual dependent balance today. Another system is the inner ear, or vestibular system, and that's a really cool system where it allows us to know where we are in space regardless of our vision. So if I were to blindfold you and flip you upside down, you would know you're upside down because the little vestibules in your ear would send signals to your body and tell you where you are in space. And that can get tripped up with head turns or positional changes. That's where vertigo comes from. Or if you spin around in a circle and you get dizzy, it's because you've kind of confused the inputs that come from the canals, the vestibules in your ear going to your brain. And then the third main system is what we call the somatosensory system, which is input you get from all of the joints in your body. Every single joint in your body has little receptors that tell the brain where the joints are in space and how they're positioned. Every single movement, every single nuance, there's a receptor that tells you how it is. So if you're blindfolded again and I take your hand and I move it into a fist, you know that your hand is in a fist because of that somatosensory system, because the joint receptors are telling your brain now all of the fingers are bent. And so we have these in the feet and the hips and the knees all the way through, and they give the brain awareness on not only where we are, but how to change position in order to maintain balance. So those are the 3 systems: vision, inner ear, and joint receptors, or somatosensory. Now, on top of that, there's lots of things that also go into balance. We have attention and awareness. So if I had you do arithmetic in your head, something that took your mental focus away from balance, your balance would suffer. Everybody does. The balance ability suffers. On top of that, stress or anxiety makes a big difference in balance. Imagine if I were walking across a 1-foot plank on the ground, I wouldn't have much issue, but that same exact plank, if you put it 100 feet in the air, suddenly my balance would be different because the consequences are much higher and the anxiety level rises, and therefore my balance changes because of the perceived consequence of the action, so not just the action itself. Finally, medications can really play an impact in balance, especially if you take multiple medications that overlap each other. So you might find that if you're taking some sort of medicine, it makes you a little bit groggy, or it may impact how your ability to move around is. That is something else to be aware of. So we talked about safety, that's a big part of it, but we're also going to talk about function. Little things to notice that maybe might tell you that your balance is on the decline a little bit is if you notice that you walk around and you like to have a hand on a wall, or you walk around your apartment and you like to touch all the furniture, the countertop everywhere you go. That is usually a way to have an extra support to bolster up your balance, and a lot of times this happens pretty subconsciously outside of our awareness, our body just telling us, maybe we get an extra hand for stability. If you notice that your walking speed has slowed down quite a bit, that is often an indicator of a bit of a decline in balance ability, because to walk with a longer stride requires more time on one foot, which requires more balance, and so slowing down really helps us to feel more stable, to be on 2 feet more times than 1 foot. And then also how wide you keep your legs, your frame. Some people stand with a very wide base of support because a wide base makes you feel a little bit more stable too. So if you've noticed that any of these things have been happening to you recently or over the years, it just lets you know that there's an opportunity to maybe improve some of the balance that you have, and that'll help you get through your days a little bit easier and a little bit more confidence, and hopefully a little bit less stress. So we're going to get started with some assessments right now, and so all you're going to need to do is stand up, and we're going to get started. All right, so we're just going to start standing, and the first thing that I want you to be aware of is first and foremost, safety is key. So when we're testing balance, obviously, we don't want to put ourselves in a position that we can fall. So you want to make sure that if you're doing this, you're doing it next to a wall or in a door frame where you have 2 hands, or in front of a countertop, or sometimes you can use the back of a chair. Anything that can create an opportunity to catch yourself if you feel like you're off balance. Do not compromise your safety or risk your safety in any way. It is not worth it. Okay, so first we're just going to stand on the feet and see how we feel on our feet. Just a little, we do our laying check-in most of the time, or lying check-in, excuse me, and we're going to now just do a standing check-in and see how we feel. So just feel how your body lines up over your feet, and don't try to change anything. Don't try to make yourself perfect or do whatever you think you're supposed to do. Just feel for where you are. And I'm sorry, this is most easily done, or most optimally done without shoes on, in bare feet preferably, or at least in socks. I'm going to do it in shoes, but for you, take off your shoes, take off your socks, so you can really feel the floor underneath your feet. And so we're standing, and we're just getting a sense of ourselves, and if we feel our body weight on the heels or body weight on the toes, do we feel a little bit more on one leg than the other? Do you feel like your torso pitches forward or backward or sideways? Just get a sense of where your body is. Don't make any changes. Okay? And get a sense of how steady you feel just on your feet. For some people, this in and of itself is a challenge. If that's you, that is fine. And if you feel solid here, great. We're going to slowly progress the challenge as we go. And so we're going to start by narrowing the base. So you're going to take your feet and you're going to move them just together. And you're going to hold your feet so that your heels and the balls of your feet are touching each other. No V's, okay? So you're going to be together straight on. And your hands are either going to be on your belly or across your chest, but not out to the side. And you're going to see in this position, are you able to hold? And the ability to hold this position for 30 seconds indicates an adequate ability to balance in this position. So we're just going to hold this position and see how you feel. And you want to notice, is there a lot of swaying? Are you having to make corrections as you go, or do you feel that you can stay steady? If you sway a little bit, that's okay. The body sways naturally. Your ability to recover from that is important. And you just want to see how you feel in this position. And now, once you're here, this is going to be a little bit more challenging, so make sure you have any safety that you need around you. We're just going to close the eyes and notice that when we take away that visual system, that the body tends to sway a little bit more, and your attention might come to your feet, that your feet are working a little bit harder to hold you up because you can't see the world around you to orient yourself. So you have to use only your inner ear system, your vestibular system, and your joint receptor system. And if you feel like you're off balance, just open your eyes, right? And you'll feel that instantly you feel a little bit more steady and secure. So if you felt that there was a big difference between your ability to stand with eyes open to your ability to stand eyes closed, it just lets us know that you are a very visually dependent balancer and that you need to practice a little bit of eyes closed activity to bolster up your balance resilience, really. Now the next thing we're going to do, same position. If you need a rest and you need to open up your feet and shake it out, go ahead and do that. You don't have to hold that position. Go at your own pace. Do what makes you feel comfortable. We're going to go back to the feet together, narrow base of support, arms crossed over the chest or over the belly. And now with eyes open, what we're going to do is we're going to just turn the head left and turn the head right. And then I want you to do that, and I want to see if you can do that quickly. How quickly can you turn the head left and right? And you're going to feel that that is going to throw off your balance a little bit because it confuses that vestibular or inner ear system, okay? If you can't move your head quickly, or if you feel like you get dizzy, certainly stop. Again, do not put yourself into a compromised position. Once you realize that you have some deficit, there's no need to do more. You've already assessed that, challenging the inner ear challenges your balance, lets you know that you have a little bit of a dependency on that system a little bit more than some of the others. If both of those things were easy for you and you really want to challenge yourself, you could do both. You can close your eyes and turn the head and see how you can manage that exercise, that activity. But again, don't try this if you felt a lot of challenge in the other two. This is just if you feel like you really need a little bit more. And if you can manage both of those, you're in pretty good shape, okay? Now the next thing we're going to do is we're going to alter the base of support from having 2 feet together to having what we call a semi-tandem position. So you're going to have your feet just one over the other, just like this, or from a side view. So your heel is just about at the point of the ball of your foot, okay? So we have that heel just about at the point of the ball of the foot. And we're going to hold that position, and we're going to see how you feel in that position. And this challenges your base a little bit more. It makes that base a little bit more narrow, and it makes your feet have to work a little bit harder. And then from here, we see how you feel. We put the hands across the belly or across the chest, and then we see how we feel. Can we maintain this position for 30 seconds? And we're going to go through the same process that we did for the other two. If you were challenged with feet together, there's no need to go into the semi-tandem stance. But if you were really good at that last one, we go to semi-tandem just as another progression. And then you can add eyes closed and see if that increases the body sway, or see if you feel steady and stable like that. And then you can go eyes open and turning the head from side to side and seeing what that does to your balance. And if you feel that you get off and you take a step, that's fine. You just reorient yourself and try again and just see how comfortable you are with head turns. And some people are really good at one and not so good at the other, and that's okay. That just lets you know where your challenges are and where your opportunities are to improve. Okay, we'll do that for 30 seconds as well, and then stop. And then if you really want to up the challenge, again, we can combine eyes closed and head turns and see how we do it there, but that's kind of a little bit of bonus work. All right, now if you're doing well with that, we're going to go into a full tandem stance, and that's a full heel-toe position, okay? So from the side, that looks like this. You're going to be full heel-toe. If you offset your feet just a little bit and you're kind of at the side, it's going to make it much simpler and much easier. So for consistency, we want to be in that straight line. Imagine you're on a balance beam or a tightrope, heel toe. You don't want to cross over. That's a little bit more tricky. So we're just going to be in this heel toe position. I'm going to face you. So I'm in this heel toe. And then from here, we're going to see how does that balance work. And you're going to find that this is significantly trickier than the rest. Okay, so if you were okay with the other two, and then this is challenging, it just lets you know that narrow bases of support are a challenge for you, and that's where we need to work on your opportunity to improve. Okay, so we're just going to hold this position and see how you feel. Feel the feet wobbling underneath you. That is healthy, that is normal. An active foot is working to help you manage balance, and that is absolutely what it's supposed to do. So if you feel that working, that's great. If you feel that your feet are still, it's going to really compromise your ability to maintain balance. And then we can stop and shake it out, and then we can switch feet the other way. Typically, most people, use a hand to get into that position, because sometimes just getting into the position is tricky. And then most people put a lot more weight on their back foot than their front foot, kind of like a 70-30 split. So I like to do one foot and then the other, just to see if there's a difference between having the left foot back versus the right foot back. And again, can you put the hands on the belly or across the chest? Good. And then from there, if that feels simple, we can close eyes. And now I'm going to start to get challenged a little bit here. I feel my sway increase. I'm still able to maintain balance for the most part. I haven't had to take a step yet or reach, but definitely closing the eyes in a tandem position is a challenge for me. All right, but once I open, boom, I get solid again, because I have that visual stimulus, that visual input, and I can find myself. All right, and now from here, we're going to try the head turns, turning left, turning right. Again, this is going to throw things off, and so see what you can do. Okay, and the faster you go, the more challenged it becomes. And we're just going to keep moving that head left and right for 30 seconds, or you can just do 15 rotations, whatever it is. The more you go, the more off balance you might become. And if you need to stop and orient yourself, you can do that, but don't put yourself, again, into a compromised position. All right, so now we've moved through feet together, semi-tandem and full tandem stance. Now we're just going to shake it out, relax the legs a little bit, because I know that's a little fatiguing. I can feel my legs working when I do that. And now we're going to go into single leg stance, which is sometimes for some people not as difficult as the tandem stance. So no matter how you did on the others, it's good to try. So try with a hand on a chair, or a hand on a countertop, or a hand on the wall, whatever you need to do. And then from there, we're just going to shift weight from one foot to the other. And first, I like to just shift weight slowly and keep one toe down, just light, and see how I feel. And then, if that toe can be nice and light on the floor, can we lift it up, and can we hold and maintain? And again, we're not trying to do anything specific. We're just holding and seeing how well we can hold. And then when I post this online, I'll put all the norms. There's different norms for different age groups of how long you should be able to hold each position, and these different tests that we're doing, and I'll post that so you have it in a written form. And then you see how you feel. Good. And if you can hold that for 20 to 30 seconds, that's excellent. That's definitely solid within the safe range. And we'll come down and shake it out, because again, that is a lot of muscle work. And from there, if you want to try one foot, and then if you're feeling brave and you want to try one foot, eyes closed, and you can see how that challenges you. I put my arms out inherently for balance when I put them in. I got to do a lot of work. And I lose it. Okay? And so let me see, after we do that, let's try the opposite foot. So I'm just going to go gently to the toe, and then to one leg, and see how we do. And I feel like my left leg maybe not as solid as my right. That's usually my trouble side. And then if I wanted to try eyes closed, we'll see, what happens? And you see much more quickly, I start making big corrections, and I'm all over the place until I have to step down and rest. Okay? I've gone through progressions from the more simple side to the more complex side. There's nowhere where you're supposed to be. Remember, rule number one, always be kind to yourself, and that not only means being kind by not putting yourself into pain, but also being kind by allowing yourself to have these deficits, by not getting down on yourself or really talking badly to yourself about how you feel because you can't balance. Balance sometimes really gets people frustrated and angry, and it's just an assessment to see where we are. All right, we're going to do 2 more assessments. So these were all what I call static balance activities. So learning to stand in one place and how well we can stand in one place, but balance typically isn't static, it's movement, it's moving around and how easily we feel moving. Some people are able to stand in one place very well, but they don't move around very well. So there's a couple of dynamic exercises or tests that we can do to see how well we balance. So we're going to go through those now. And so all you need for this one is a chair, and you're going to sit in a chair, and then we're going to go with no hands. We're going to stand up and see how many times you can go from sitting to standing in 30 seconds. And I got my timer here, so that way I can check. And then we're going to try that. Now, if you have pain going from sit to stand, or sit to stand just doesn't work for you, it may not be an indicator of poor balance. It could be an indicator of other things. I told you there's no perfect test. So if this is limited by pain for you, just leave it out. But if you're comfortable with this, it can be an indicator of how well you can balance. So I'm going to start the timer, and then we're going to stand up and sit down as many times as we can comfortably without using arm rests, right? Without using hand support. Okay? Ready, set, begin. And so we're going to go up and down. And this might get tiring. That's okay. And make sure you're counting for how well you do and seeing how comfortably you can move. We're halfway there, 15 and 20, 10 more seconds. Keep going, do your best. And again, for this, for different age ranges, there's different norms, but by and large, if you can get, and that's 30, you can stop. If you can get 15 up and down in that 30 seconds at any age, that's considered not a falls risk and in a good position. So that's one more test to see, and so you're just grading yourself to see how well you did the first set of static activities, and now the dynamic activities. And now there's one more dynamic activity I want to do. And so for this, we're going to put the chair to the side, and you're going to clear 10 feet of walking space. And you can estimate this, or you can measure it out, and we're just going to time how quickly we can get out of a chair, walk 10 feet, turn around, and come back. And this one you're allowed to do any way you want to. You can do it with your hands, you can do it with a cane, you can do it with a walker, however you feel comfortable, but make sure that you are safe. Don't rush, don't run, don't put yourself at risk of falls. If you feel unsteady or uncomfortable, don't do it. So we're going to start, and we're going to time yourself, and we're going to stand up, and we're going to walk 10 feet, which for me is the end of the wall. Turn around, come back, and return to sitting. And for some of you, that might be a piece of cake, and it's really nothing at all. And for others of you, it might be quite more challenging. That's okay. And again, for different age ranges, there's different norms for how quickly you should be able to go back and forth. But by and large, if you can do that in 12 or 13 seconds, you're in pretty good shape. If it takes longer than that, you might be at some risk for falls. Okay? So those are our objective assessments for balance. Right? So if you notice that you had trouble when eyes were closed, we need to work on a little bit more eyes closed exercises because you're reliant on the visual system. If you notice that you're a little bit more challenged with head turns, that means you're pretty reliant on the vestibular system, and you need to challenge the other systems a little bit more by confusing that system. And if you find that you're more challenged with a narrower base of support, like 2 feet tandem stance or 1 foot, that means usually that the somatosensory system in the ankles is a little bit more challenged, and you need to work some more narrow-base balance exercises, which we'll get into in coming weeks. If you found that all of those were good, but you had a little trouble with the sit to stand, or you had a little trouble with the timed up and go or 10-foot walk test, that usually means that it's more your dynamic. It's controlling your center of gravity is more challenging for you than maintaining static balance in and of itself. Okay, so we've done this assessment. You're getting a sense of how strong a balancer you are or aren't. And I promised you we would do one thing. I don't just want to point out deficits and not give you any tools to change them. So we're just going to do a simple balance exercise today. I want you to stand comfortably with your feet together. Yeah, they don't even have to be together, but not so wide apart. But comfortable stance, they're a little bit narrow, but they don't have to be touching together. And from here, we're going to kind of work through what we call the cone of balance. So everyone has this cone of balance from the feet up and out. And so if you imagine that you're standing on a big clock with 12 o'clock in front of you and 6 o'clock behind you, we're just going to work on a little bit of sway. You're going to keep your body upright, and we're just going to sway forward towards 12, and then back to center. And forward towards 12, and back to center. Again, from a side view, that's just forward towards 12, and back to center, and see what you can do. And don't worry about how far, just stay within your ability level. And then we're going to go around the clock, each number one by one. So we're going to go 12, and back to center, and then 1 o'clock, and back to center, and then 2 o'clock. And what I want you thinking about is how your feet are contacting the floor. 3 o'clock, and then as we get to these back, we don't go quite as far, 4 o'clock, and where your feet make contact, 5 o'clock, and where they don't, and their ability to shift and contour to the floor as the demands require. And now I'm going to 7 o'clock, and as I go this way towards the left, I feel the outside of my left foot really taking pressure into the floor, and the inside of my right foot putting pressure into the floor. That's 7, and then 8 o'clock, and as I go left, I want to feel that movement of both feet. 9 o'clock, and then 10, and 11, and now I'm feeling myself go from pinky toe to middle toe, and then 12 to big toe, and feeling how both feet are working to maintain balance. And just get a sense, if there's one point of the clock that feels like, it's pretty daunting for you, work on the numbers around it and kind of hone in on that area. So it's just a real simple way to start to improve our cone of balance. If you can only move a little bit, start there and just build. Just start from where you are. Don't try to break any barriers. Don't try to win any awards. Just start from where you are, and then slowly over time you'll improve. Now if we want to make that a little bit more tricky, we're going to go to 12 o'clock, but instead of coming back to center, we're going to go 12, 1, 2, 3. So we're going to go 12, and then 1 o'clock, and 2, and 3, and 4. So we're kind of rotating around in a circle. 7, 8, 9, 10, 11, 12. And as you do that, you should feel how your feet kind of roll around into the floor to support you. And you want to make sure that you can allow your feet to be soft and supple and really contour to the floor as easily as it can. So your feet are almost like liquid. They're like water just flowing into the floor to get you the support. And we're looking for how big of this cone of balance can we make. And then when we come back to 12 o'clock, we'll come back and we'll stop at the center. Always regroup. Take as much time as you need. Work at your pace, not at my pace, whatever works for you. And now we're going to do the same thing. We're going counterclockwise. Forward into 12, and then 11, and 10, and feeling that ability to roll through each number nice and slow, nice and simple as we get to the back, staying within your ability level but challenging yourself, and feeling how the feet are soft and supple and can contour into the floor, or maybe noticing that they're not soft and not supple and they don't want to do what you want them to do, and being okay with the fact that that's a challenge for you, and knowing that that's just an opportunity for you to get better. So once we can identify a deficit, that is wonderful, because that's always the first step in improvement. If we can't identify the deficits, we're just going to stay where we are and feel how you can move around, and that nice contour. Come back to 12, and then to center, and then relax. All right, so that was our balance assessment today, along with just one simple balance exercise. Next week we'll come up with a few more interesting balance exercises for you. I hope you found that helpful. Thank you so much for joining me this week, and thank yourself for doing something good for you. You deserve it, and it's hard to do. It's hard to go and do these things week after week to improve yourself, so that's fantastic. I'm Dr. David Sofer, physical therapist. This is Arthritis Help, and I'll see you all next week. Take care.